Hello and welcome to the Beyond 6 Seconds podcast. I'm your host, Carolyn Keel, and on today's episode, I'm speaking with Eugene Manley. He's a cancer scientist, health equity leader, and longtime patient advocate working at the intersection of biomedical sciences, cancer care, AI ethics, and leadership. As a Black healthcare advocate and founder of SCHEQ, which stands for STEMM and Cancer Health Equity, a nonprofit focused on cancer health equity, Eugene runs an annual lung cancer summit that brings together patients, clinicians, researchers, and industry to co-create solutions to disparities in screening, diagnosis, and treatment. Eugene has ADHD, which didn't get diagnosed until he was in graduate school. Eugene, welcome to the podcast.
Hello, it's a pleasure to be here. I can't wait to have this conversation.
I'm really looking forward to learning more about all of the really great work that you're doing and also about your own ADHD journey. You got diagnosed later on in life when you were in grad school, but how exactly did you realize that you had ADHD?
Well, I didn't realize I had ADHD. I just always knew that my brain was wired differently. People would respond all the same way to something. And my brain would be like, well, I'm not going to do it just because everyone else is doing it. And I didn't think that was me being a rebel, but it was just how I functioned. My mother said I was very shy until I was about 4 or 5. And then my mother said, when I went to Head Start and found out I was smart, then they could never shut me up. So I would be the type that would be in class yapping my mouth with everybody, but my work would get done still and no one else's. And I didn't really think anything of it. And then I went through high school, but always just knew I did the road less traveled. I still never really fit in groups. I never wanted to be in groups, but I was always the one to talk to people that tended to be isolated from a group, if that makes any sense.
Yeah.
And I only maybe thought something in undergrad because I was used to study so hard for exams and super stress out and then still not get high grades. And I was almost at the point of burnout. And I still didn't know I had ADHD. I said, okay, something's going on. And it didn't get diagnosed until I was in my master's, I believe. No, yeah, early part of my PhD.
Wow. So what was school like for you? Was it kind of boring? Was it hard to focus? Were you kind of just interested in other things? What was that like?
It's weird. It was easy to focus on the things I liked, but if I had no interest in it at all, that was just like the inertia was not going anywhere, and that's what made it hard. And that's eventually what got me out of all the engineering that I was doing. Like I could do the math and the computations, and then finally I hit a wall at some point after my master said, I just don't want to do this. And then my brain was just, nope. And I still understand it, but I was like, I'm not. So that's sort of how that shook out.
Yeah. And so you've done a lot of different things in your career, and it sounds like a lot of those were driven by your various interests. When you were doing your master's, did you say you started out studying engineering at first?
Well, my undergrad was in mechanical engineering.
Okay.
And then I went and did my master's in biomedical engineering.
Oh, wow.
And I had originally started my PhD in biomed, and then they were making us do an applied math course that I knew I would never use. And I said, I'm just not going to sit through this. And so I ended up transferring to a more molecular program and then got back into wet biology and did a lot of molecular biology, combination drug therapy. So that was interesting and fascinating. But at the same token, even though was diagnosed early in the PhD, I didn't start the meds until late because it was getting really hard for me to sit in the chair for 4 to 5 to 6 hours to do experiments. And that was always a challenge, always.
Okay. So yeah, that is an interesting turning point about what changed that kind of prompted to say like, oh, maybe there's something going on here regarding ADHD or something. So it was the fact that you were in, like, I guess essentially labs where you were in the same place and had to focus for very, very long periods of time.
Yes, and couldn't leave because you stuff that's time sensitive and my brain is I can do it, but I'm not good at sitting still.
Hmm? So did you get diagnosed through the school that you were at, or did you pursue something separately?
I was diagnosed at the first school in Jersey, but I didn't get re-diagnosed until, well, it was more so I got re-diagnosed so I can get on treatment late in the PhD. But the problem was we still didn't have a great insurance plan, so it was basically medications were unaffordable.
Oh, yeah. That makes it tough. There's a lot of challenges with people being able to get medication, especially for ADHD, for a whole variety of reasons. Wow. I'd love to learn more about how your career shaped. So you went through a couple of different areas of study, starting with mechanical engineering, then biomedical
Biomedical
engineering.
engineering,
Yeah. And then what was your PhD on?
molecular and cell biology, and biochemistry.
Wow.
Now, on its root level, it looks like that's so unfocused. But for me, it made sense because when I grew up, I had a chronic asthma and allergies, and I was in
Hmm.
the hospital a lot. I also really like Transformers. So I had this thread of engineering and biology in my head. So me jumping back and forth between them made sense to me. I always was a person that learned and wanted to do different things.
Hmm.
So that's sort of where we got to doing a PhD in molecular biology. Now, I didn't know I was going to end up in a cancer lab. It just so happened after I did my rotations that lab had a pretty good track record of getting publications and people left to go on to do great stuff.
What kinds of jobs and career did you have before you started your nonprofit, like after school or during school?
Well, even when I was in undergrad, I spent my summers doing biomedical research.
Hmm.
And that was mainly because my science department head in high school saw my aptitude and she helped me get my first job in a lab in high school at the Michigan Cancer Foundation. And then when I went to do my master's at Wisconsin, I did biomedical engineering. I did knee ligament biomechanics, and then the combination drug therapies and tumor microenvironment and lung cancer for my PhD. And then when I started my postdocs, I originally wanted to study cancers that metastasize to bone, because that would
Oh.
sort of be a good way to bridge both of those areas. So I did some work in bone biology again and bone biomechanics, and then I went to look at arsenic induced carcinogenesis in lung epithelial cells. And then I went to a breast cancer lab to work on invasive proteins and then eventually looking at using histological staining to change different markers in the cells of antibodies that then you could digitally change the color to something different. And then you could look at how everything happens on a single cell level to see how things change as a function of tumor growth or resistance. And then I finally said, I'm off this postdoc train because I still wasn't really getting help getting grants and they weren't getting funded. And I said, I'm getting too old to still be struggling and trying to make a path that clearly is not going to happen. So then I ended up getting a job in the nonprofit sector. That was not my original choice. It's just I applied for so many rounds of jobs near the end of that postdoc, and it was just impossible to get called back. So you get the first interview, and so I ended up at the AACR, which is American Association for Cancer Research, and their foundation. And I did fundraising and development. And that made sense because I had this bio background. So I knew how to talk to the different pharma companies. And then I went to Lung Cancer Research Foundation and Longevity, which are two lung orgs. And I oversaw grant systems, developed mentorship programs, and did outreach for underserved communities. And then they started reaching out to me to ask me to develop content and programming that helped them understand lung cancer better because they typically were not seen in materials on many organizations' websites. So that sort of led me to then create the nonprofit. And it's part of the combination of me growing up as a first gen scholar and seeing what I did and didn't have, looking at how healthcare was and wasn't delivered to my family and how they would never understand the stuff and try to read my chart. And it was just virtually impossible. And then trying to make sure we get those diverse scholars to go into these fields and help them get into spaces where they can hopefully work on behalf of underserved communities so they can get equitable care.
Wow. But yeah, it sounds like you had just so many interests and passion that you wound up getting a whole lot of experience, not just on the STEM side of things, but also around how to communicate that information, and especially sharing it and communicating in ways that, people who aren't studying this at a graduate level can really understand, because that's a huge challenge for people to understand like their own medical diagnoses and their options. That's such a critical thing for people to really see.
Yes, you don't do a great job with health literacy
Mm-hmm.
in the US, but also worldwide. Patients don't understand information. They don't know how to ask questions. They sometimes are dismissed or ignored. And so it's really incumbent upon us to try to teach people how to better conceptualize this terminology. And so part of the work we do is creating infographics that break down medical information and cancer information.
Mm-hmm. Are there specific populations of people that you work with or especially, focus on when you're working on your communications?
We like to try to make it so it's accessible for Black and Hispanic, but we still think the goal is to educate all. So now, in instance, we may have an infographic on a disparity, and one of the infographics is ovarian cancer in Black women. And that is, of course, you want to have representation because often underserved communities never see themselves in material. So by putting a face or image in there from that community, they're more likely to feel seen and more likely to engage the materials. So we try to target this stuff that way when we can, but when it's general medical information, it's harder to target, but you still can make it at a 5th to 8th grade level. So that's what we try to do and make it digestible and try to put little icons or imagery in it that helps you, conceptualize what's being said.
Mm-hmm. Yeah, absolutely. Yeah, that's so important for people to see and also see themselves represented in materials because, yeah, it's really important for part of that communication. You had mentioned as you were working in the nonprofit sector and work to now build and run your own nonprofit, part of that was from your academic and career background, but also from your own personal background and your family's background around your own experiences in the medical system. Can you talk a little bit more about that and how it informs the mission of your nonprofit, SCHEQ?
Yes. When I was growing up and even in adulthood, I just saw how often doctors would just disregard my mother or just say, oh, well, the instructions are in my chart. But one, you're not going to get to page 5 of my chart because the first 5 pages is all medical jargon. And so if you don't have a medical background, you're going to get frustrated, angry, and that's often what happened. And she would sometimes be in hospital because she had several hospitalizations. And there would be hospital staff, especially the night staff, that would be rude or dismissive and condescending. And so it seems that sometimes liberties are taken when people assume you're poor, uneducated, or can't really advocate for yourself. And it makes it frustrating to engage in care because if you're supposed to go there to heal and you're getting harassed, then why am I here? And it made it so much more clear for my own work when I was in hospital last year because I had a slip and fall fracture of my ankle and then I had reconstructive surgery of my foot. Wow. And it was extremely painful and I was supposed to be a non-weight bearing surgery. So I'm supposed to be non-weight bearing for 6 weeks. Now, because I have a background in biomechanics, I was prepared for the surgery. All I asked for the surgeon was to get me a skilled nursing placement for like the first 2 to 3 weeks so that I could at least have someone help me because once you have that surgery, you have only one leg you can use, you have a cast, and you then have to either use a walker or a rolling scooter, but you can't do much because both of your hands are then occupied, so you can't really cook, clean, wash, do laundry. And so the surgeon agreed. However, the hospital staff decided to collectively misrepresent things in my medical records and do their best efforts to deny and impede care delivery. And the first physical therapist who I saw 36 hours after surgery, who was supposed to do the assessment, had this horrible bedside manner, was rude, forced me to stand and use his walker, which I was scared for my life because one, I already have surgery and all the blood is rushing to the foot, but I have to hang this foot in the air and then want me to hop on the opposite leg. Now, mind you, I'm 300 pounds, already have a left ACL reconstruction on the left foot. Wow. And flat feet, but you want me to hop while I'm still really on heavy painkillers. But that's what she did. And what she wrote in the chart, which I did not know this, patient has no pain and can ambulate.
Wow.
That's what was written in my chart. And I didn't read that till 3.5 weeks later because when you're in there day to day going through, you're not of sound mind.
Mhm.
I had a medical proxy in Florida, but they never contacted my proxy. What I learned is if they have a thing called AO times 3. So if they think you're alert and oriented, so like if you know the day, time, and space, they'll consider you oriented. So because I knew those things, they said, well, this was alert. So they had so many people coming in those first 2 days. I don't remember any or most of it, but they were saying, well, patient agreed to this. I said, I didn't agree to any of this,
Wow.
but they wouldn't call my proxy who I put in my place because I know while my brain normally fires. So, the ADHD brain.
Mhm.
And then they tried to give me a discharge notice that second evening, like at 6:30 p.m., but it was back written for 9:30 a.m. And I said, this is not legal. Like if you gave it to me at 6:30, you can't say I have to notify insurance by noon the next day. That's not 24 hours.
Yeah.
So it was, this whole effort to push you out. And then the hospitalist a couple of days later asked about my ability to pay. And I just said, oh, I get it. They don't want to really deal with me at all. And, at that time I was on Medicaid because, I launched a nonprofit. So I don't
Mhm.
have a ton of revenue. So I'm on Medicaid and poor and black. And so they decided that they're going to ignore standard of care and just give me the bare minimum. And unfortunately for them, they don't realize I know how to read medical records.
Mhm.
And so I read this weeks later and it incensed me because while I'm there, they said, oh, if you agree to go home, we'll get you skilled home aid in this. But because they already had misrepresented in my records, I had no pain and could ambulate. The surgeon lost his peer to peer to get me in skilled nursing. And it took 5 days for PT to answer because they didn't want to answer him until he finally complained in the hospital. And so surgeon was finally able to plead with insurance to give me a couple days of an aid. But basically I was stuck then home alone all by myself, which was the sole thing we wanted to avoid. So it was pretty harrowing. And I basically lost all of last year because of the pain and the surgery and not being able to walk and then not being able to walk without swelling until October. So yeah, so it was basically a lost year.
Wow. Yeah, and that's outrageous, and I think that type of story is way too common. And even having it happen to you, you as someone who can read medical charts and understands a lot about how this works and was very prepared, and for that you still to have an experience like this, I can only imagine what it's like for other people who are not, reading medical charts and understanding. I know even some of my own documents that I get, I can't entirely understand like what the medical results are saying, and it needs to be explained to me. So yeah, I got it. Yeah, it's so important to be able to communicate that and to help advocate for people or help people advocate for themselves, which is so
Yeah.
hard to do, especially just coming out of surgery or a medical
Mm-hmm.
procedure where you're still on painkillers, you're nervous, like all those emotions and all that physical pain. It's a really, really difficult time. And I really wish it were a lot easier for people. And yeah, medical staff do. There are lots of cases where they just make a lot of assumptions about people based on the type of healthcare they're getting and what they look like and where they're from, and just treat you in ways that they should not be treating you.
Yep,
So yeah.
exactly. So what I did is I did do a little video series about what you can do when you go into a hospital. So you learn, have a proxy, learn who to report things to when stuff happens, make sure you send it by certified mail, know the Joint Commission for Hospital Accreditation and any other credentialing agency. So I did learn a lot more about reporting, and you can report to insurance, you can report to Medicaid. I learned a lot more than even I knew, but it reinforces why this work is so important. And if you did this to me, who is educated and knows how to navigate, how many other poor, underserved, marginalized people are pushed out of hospital who don't even understand why and can't read and then readmitted again for no fault of their own?
Mm-hmm. Yeah, absolutely. And then trying to fight with insurance companies to, is like a
Yes.
losing battle a lot of times. It just takes so much time. Yeah. So I totally understand how you lose a year of your life basically between the
Yeah.
pain and all of the aggravation and the back and forth between, medical and insurance and all of that. Wow. How is your ankle feeling now? Are you feeling better these days?
I went through rehab and I literally did my last physical therapy appointment in the end of December.
Wow.
So on the one hand, the foot is rehab, but the downside is because I basically was in a walking boot for most of the first 6 months, I now have partial labral tearing in my hip
Mm.
and tendinopathy in the hamstring. So now I have to get that seen by another orthopedic surgeon.
Oh, wow. Yeah. So these types of things have long-term consequences as well. So
Yes.
yeah, that's really frustrating. So yeah, I think it's great that you're doing this type of work to help people, like to help educate them and help them understand the types of medical care that they're getting and understand more about what their rights are and what they should be entitled to as people interacting with medical systems. Do you work in your nonprofit with doctors and healthcare professionals or mainly with communities for education or both?
We can do both because I sit at this weird intersection of
Mhm.
education, advocacy, and awareness. I will work with community groups to speak about cancer disparities. I will work and go to STEM events to talk about STEM careers, navigating career transitions. And then I'll work with clinicians, specifically in the lung cancer stuff. And we do our annual lung cancer health equity / intervention summit that is focused on not just talking about the disparities that impact Black and Hispanic and other underserved communities, but what solutions are different stakeholders at all levels implementing that are making an impact for these communities.
That's important work. And in terms of like overall goals for the nonprofit, are there overarching goals? I mean, obviously, like, helping people understand what their rights are and how to interact with healthcare professionals and the healthcare system. Are there sort of larger, like long term goals that you have for it?
The longer term goals, we just want to be a starting point and resource for anyone trying to navigate medical or cancer information. Eventually, when we start really rolling out our STEM stuff, we want to be a convener for students trying to learn how to get in the STEM fields, figure out what paths they can take, and learning how to navigate undergrad, grad, professional school. And then at what point do you pivot or do you decide, oh, well, there's a path here that you don't know about because you're not taught, but how do we make sure you learn that? And then third, just making sure we keep centering the patient and their awareness and advocacy in all the work that we do.
I think that's a really great support to have, and that people need to be more aware that this, education is out there. It's really hard to go through the stress of having a medical issue and then realize that you can't just focus on getting better. You have to deal with all these other things, whether
Yes.
it's like discrimination and racism in the system or just
Yeah.
dealing with insurance or like all like, just trying to worry about how you're going to be treated and if you're going to get the services that somebody said you would get. So it's so much to deal with. So it's really helpful to have people guiding through that who understand the systems.
And on top of that, my mother had died early last year. So I had that in between all of this. So it is, when I say everything hit consecutively last year, it really did. And it's enough to tackle and knock down most people.
Yeah, absolutely. Yeah. So sorry for the loss of your mother. It's yeah, a lot to deal with. Wow. Yeah, well, I'm certainly hoping that this year and future years that your path is eased very much and that
Yes,
a lot of
because
that.
I don't think I get to survive another
Oh my
year.
gosh. Yeah. Yeah, cuz the work you're doing is important. Absolutely. I'm really grateful that you shared your story because, talking about having ADHD and obviously everybody's different. Everyone has different experiences, but you have a really like fascinating example of how you had a lot of different interests and you were able to focus really well on things that interested you and you wound up building a career that, flowed through a lot of different subject areas, but it all works together. I'm sure you didn't envision starting a nonprofit
Exactly.
at the, back in like undergrad, but, a lot of times we can build careers that don't exist or that are brand new to us and make a lot of difference.
Yeah, it was never remotely on my radar. But
Mhm.
what often happens with ADHD people is we don't really fit well in corporate leadership structures or boxed in systems.
Yeah.
And so you end up with a lot of time wrecking your brain and and upset and angry, frustrated, and trying to do impulse control and trying to not say the first thing that comes to your mind.
Mhm.
And often many end up becoming entrepreneurs or solopreneurs just because it's the only way they can put the broader image they have, whatever constructed in their head, into play. And so that's sort of what many of us do. And I just happen to turn mine into a nonprofit.
That's really cool. You had even mentioned earlier that a lot of times when you were younger in school that you tended to gravitate towards people who maybe were not the super popular kids, but maybe the kids who weren't as popular, weren't as integrated. And in some ways, I kind of see that extending in a general term to now helping other populations who are not as, integrated or super like educated in medical things and helping them. So it kind of seems like that's also a constant theme throughout your life as well.
Yep. And, that's also another thing with a lot of ADHD people. When we're focused, we are receptive to everything. It's just a matter of what we actually respond to. And I just tend to respond to isolation, or maybe I just know what it feels like to sometimes be isolated. And I just said, well, you don't have to be alone. How can we help you? And I just try to make sure everyone is included and feels seen.
Yeah, that's really awesome. Wow. Well, thank you again for the work that you do. How can people get in touch with you if they want to learn more about the type of work you do or get involved or learn more about SCHEQ?
Thank you. You can find us on our website, SCHEQ, SCHEQ.org. We also have a donate button if you want to donate and a button to reach out if you want to volunteer. We have our socials, LinkedIn, Instagram, and Facebook are STEMMCHEQ. And then you can also follow and find me on LinkedIn, Eugene Manley Jr., PhD. And if you just reach out, I'm working on creating a flyer on how to navigate healthcare. When they just say they were on the show, I will send that to people.
Okay, fantastic. That's awesome. Well, yeah, Eugene, thank you so much for sharing your story and talking about the really awesome and important work that you do. So, yeah, wishing you all the best with success with SCHEQ. And yeah, thanks again for being a guest on my show.
Thank you so much, Carolyn. It was a pleasure to be here, and you're doing such a great job.
Thank you.